we ready? Go ahead. Good morning. I'm Denise Winfrey, Will County Executive. Thank you all for being here today. Will County stands with Governor Pritzker and the Illinois Department of Public Health in support of the enhanced mitigation efforts. We realize that our residents don't want to be restricted in their gatherings. They don't want to forego spending time at their favorite watering holes. They don't want to limit the numbers of people in their yards. They don't want to control their interactions with others. We also realize that our past behavior is how we got to our present situation. We encourage our residents to do what is needed to help stop the spread of the virus. Wear face coverings over your nose and mouth. Wash your hands frequently. Watch your social distancing. If you must be out, make sure you follow the guidelines. Protect not only yourselves, but your families, your neighbors, the community. We need everyone on board on this round, and we believe that Will County is strong enough to do the right thing. Thank you. Next, we'll hear from our governor, Mr. J.B. Pritzker.
Well, thanks so much, Denise. Thank you for your leadership, for your kind introduction to everyone here. Welcome. A special thank you to the Will County Health Department and to Sue Olenek for hosting us today. For those of you who don't know, I also want to thank, by the way, John Beavis from the Kankakee Health Department for your leadership and assisting us in this. For those of you who don't know, the great majority of the on-the-ground burden of COVID-19 has really fallen upon our county departments of health. And that includes the criticism, the political wrangling, the frontline health decisions. And they really deserve a Purple Heart and a sincere thank you from all of us as this battle against coronavirus continues. I'm really glad that we could be joined by Senator Pat McGuire and Senator Mike Hastings, Senator Jennifer Bertino-Tarrant, and Representative John Connor, all of whom provide really admirable leadership for this region in Springfield. And I have had the great good fortune to be able to work with them over the last year and a half to try to get real things done for people who live right here in both Will County and Kankakee. In a time full of unknowns, I've made a lot of effort to ensure that our residents have as much transparency as possible in Illinois' response to this pandemic. So we all know why we're here today. Region 7, Will and Kankakee counties, has joined Region 4, the region nearest to St. Louis, in exceeding an 8% positivity rate, an average positivity rate, based upon the advice of the best doctors in Illinois. That positivity level is a danger signal that triggers new and stricter mitigations based upon the resurgence plan that I announced last month. The positivity level in this region exceeds the positivity levels in California and in North Carolina and is approaching the level of Georgia. This is a red alert for everyone who works and lives here, and it demands a renewed effort to slow the spread of COVID-19. Both Region 4 and Region 7 are seeing positivity rates far above what we see in the rest of the state of Illinois. Even a quick look at this area's neighboring regions reveals positivity rates of 1.8 and 6.7% as of Tuesday, a minimum of 1.5 percentage points below what we're seeing here in Will and Kankakee counties. That's a world of difference in fighting a pandemic. To help reverse that tide, starting tomorrow, Region 7 will be operating under the following new mitigations, we hope on a temporary basis. All indoor bar service and indoor dining service will be closed. Outdoor bars and dining may stay open for table service if they follow the required mitigations, including that all patrons should remain seated and that reservations will be required for any size groups. Bar stools will be removed to help ensure that no ordering, seating, or congregating takes place at bars. All bars, restaurants, gaming facilities, and casinos must close at 11 p.m. Party buses will be closed. And gathering limits will be the lesser of 25 individuals or 25% of overall room capacity. These new mitigations do not change the sports guidance effective August 15th, nor do they affect DCEO's current guidance for outdoor activities not included in what I just discussed. None of these rules are intended to punish or to irritate anyone. They are imposed with a sincere desire to keep the people of Will and Kankakee counties safe and healthy. Look, this virus is insidious. It's a creeping menace that can either make you very sick or cause death, and it may also be carried by you and given to your friends and family even if you don't feel sick. And they could become sick too and die. Relative to other Midwestern states, Illinois currently has a lower positivity rate than most, but our numbers are now getting worse, not better. We must reverse this trend. In the coming days and weeks, depending upon whether we can slow the infection rate, the changes imposed today could be removed, or they could be maintained, or frankly, they could also be strengthened. To a large extent, it'll be up to the residents of each region to decide where they go from here, because if you wear your mask and you keep 6 feet of distance when in public, there will be a lot fewer infections and a lot fewer restrictions. In short, here's how the region can move forward. Number one, if the positivity rate averages less than or equal to 6.5% positivity over a 14-day period, the region will return to Phase 4 mitigations under the Restore Illinois plan. If the positivity rate averages between 6.5% and 8%, IDPH will continue to monitor the region to determine if additional mitigations are needed or if at some point they can be removed. If the positivity rate averages greater than or equal to 8% after 14 days, more stringent mitigations will be applied to further reduce the spread of the virus. Following Region 4 last week, Region 7 is the second region to require heightened mitigations since all of Illinois entered Phase 4 of our reopening plan in late June. Unfortunately, the Metro East region continues to struggle with high infection rates, with 11 consecutive days of a positivity rate at or above 8%. That region sits at 9.4% today. Should things continue in that direction in Region 4, these same new mitigations that have been imposed on Region 7 will also take effect in Region 4 starting on September 2nd, the end of its 14-day monitoring period since the changes began. My hope and that of IDPH is that imposing stronger mitigations now will result in faster public health progress that will allow us to reopen again sooner. To open businesses and to keep them open, we must slow the rate of the infection across the state. With that in mind, today we're announcing an expanded statewide policy focused on restaurants and bars that's aimed at protecting our workers and slowing the spread. In consultation with the Illinois Restaurant Association and other hospitality industry partners who want to keep their employees and their customers safe, beginning Wednesday, August 26th, all restaurant and bar patrons must wear face coverings, yes, over their noses and their mouths, when interacting with wait staff and other employees. Customers must follow this rule when food and beverages are brought to the table, when orders are placed, and when picking up carry-out orders. Illinois has had a mask mandate since May 1st of this year, and in most establishments, people are adhering to it. But it's important that we treat hospitality employees just as you would in any retail store or establishment. This new requirement asks a little bit more of our residents dining out in order to protect their health and safety and that of our frontline hospitality workers. Restaurateurs and bar owners want to remain open for business, and we want them to also. And this new requirement will help keep people safe while moving the economy forward, and frankly, that's a goal that we all believe in. And to help in communicating this change as widely as possible, I want all restaurant and bar owners to know that updated guidance and signage are now available to the public on the Department of Commerce and Economic Opportunity webpage at DCEOCovid19resources.com. I'm going to say that again, DCEOCovid19resources.com. There are no dashes or dots in the middle of all that except, of course, the .com. I'll end with this. No matter if you're a resident of Joliet or of Kankakee or of East St. Louis or Quincy or Barrington or Chicago, we all want this pandemic to end and to get back to normal. If everyone would wear their mask in public and keep a reasonable distance from one another, we can reduce infections and deaths in a short period of time and keep them low until a vaccine or treatment is discovered and widely available, which I think we all believe can happen in a reasonably short period of time. Find whatever it is that inspires you to do your part. Whether you want to keep yourself safe from this debilitating and potentially deadly virus, whether it's to maximize the chance that children can have in-person learning this fall, or to keep the small business owners and stores in your area in business, to ensure the safety of those who you love, or maybe just to get back to the world where you don't have to think about cases and deaths and positivity rates every day. We might all have different motivations, but we've got to operate with the shared understanding that we will get closer to our goal if we work together on this. So thank you, and now I'd like to turn it over to our state's public health director and leader, Dr. Ngozi Ezike. Doctor.
Thank you, Governor, and thank you to our elected officials and County Board Chair, and also thank you to you, Sue, and condolences. As you've heard, COVID-19, Region 7 will enact mitigations to further prevent the spread of this deadly virus beginning tomorrow. I ask the residents of Will and Kankakee counties to please continue to take COVID-19 very seriously. Region 4, which began its mitigations last week, is actually on course to reach 10% positivity rate, which may mean stricter mitigations in the Metro East area. We don't want that for the residents of the Metro East area. We don't want that for the residents of this area. We don't want that for the businesses here. But in order for business to continue doing business, we cannot continue to do business as usual. And that's for all of us, the community members. We have to bring this positivity rate down, which means hospitalizations will go down, but we all have to do it together. Region 7 was at 8% on the 19th, 8.3% on the 20th, and again 8.3% on the 21st. And that's unfortunately why we are here today. Those increases may seem minimal, but they are representative of a much larger problem that we do have in this state. A problem that can lead to crowded hospitals, a problem that can lead to additional lost lives. I'm trying to be as blunt as possible and give the real facts here. As the governor mentioned, stop wearing your face coverings incorrectly. You're literally contributing to infection transmission by doing so. And by contributing to infection transmission, potentially to an additional life that will be lost. To the people that say that face coverings don't work, you're simply wrong. It doesn't matter what video you saw on the internet or the fake headline you read, please know that face coverings do save lives, but they must be used in conjunction with social distancing and hand washing. These are the 3 simple steps that you can all do, that we must all do to stop the spread of COVID-19 and get back to some level of normalcy. I care deeply about the state and every individual in this state. And it's my humble duty to bring you all the information and all the data to guide you to make the right decision for you and your loved ones. And so as we can lead to the water, we still can't force people to drink. And so it is everyone's individual duty as Illinoisans to care for our neighbor, to protect our communities, and fight this virus by doing the things that we know will control the spread of infection. And for today's numbers I will share, there are 1,549 individuals in the hospitals across the state with COVID-19. Of those, 345 are in the ICU and 135 are on ventilators. We added 1,680 new cases over the last 24 hours, and unfortunately, we're reporting 29 new deaths. We did result 40,859 tests in the last 24 hours. I end today with a call to action. All the community and faith leaders, public servants, moms, dads, set the example of safe living for our younger people. Be the responsible voices that they need to hear in these times of uncertainty. Not just about wearing face coverings properly, but listen to their problems and make their ideas and voices feel heard. Let's all figure out how we can work together to defeat this virus. And now I'll summarize comments for our Spanish-speaking population. Buenas tardes. Como ha escuchado, COVID-19 Región 7 comenzará mitigaciones para prevenir la propagación de este virus mortal a partir mañana. Les pido a los residentes de Will y del condado de Kankakee que sigan tomando COVID-19 en serio. La región 4, que comenzó sus mitigaciones la semana pasada, está en camino de alcanzar una tasa de positividad del 10% y implementar mitigaciones más estrictas en el área Metro East. No queremos eso para los residentes y negocios de Will y Kankakee, pero para reducir la tasa de positividad de casas y gente en el hospital con COVID-19, tenemos que trabajar juntos. La región 7 estaban en 8% el 19 de agosto y 8.3% por el 20 y 21 de agosto. Por eso estamos aquí hoy. Esos aumentos pueden parecer mínimos, pero están dando lugar a un problema mucho mayor en esta parte del estado. Es un problema que llenará los hospitales y costará vidas. Intento ser la más directa posible, dar la palabra real, así que aquí está. Deje de usar sus cubrecaras incorrectamente. Cuando hacen eso, están matando a gente. Para la gente que dice que los cubrecaras no funcionan, están equivocados. No importa qué video hayas visto en internet o qué título falso hayas leído, los cubrecaras salvan vidas. Además de lavarse las manos con agua y jabón y vigilar su distancia física mientras está afuera, estas son las 3 cosas más fáciles que puede hacer para detener la propagación del COVID-19. Y por los números de hoy, hay 1,549 personas en los hospitales. De ellos, 345 personas están en la unidad de cuidados intensivos y 135 están en los ventiladores. Desafortunadamente, hay 29 personas muertas. Me preocupó profundamente por cada persona en este estado. Es mi humilde honor traerles toda la información y datos para que tomen decisiones correctas para usted y para su familia. Es su obligación como residentes de Illinois a cuidar a su vecino y proteger a sus comunidades. Terminó hoy con una llamada a acción a todos los líderes comunitarios y religiosos, servidores públicos, mamás y papas. Sean el ejemplo de una vida segura para nuestra juventud. Sean las voces responsables que necesitan escuchar en estos tiempos difíciles. No solo se trata de cubrirse la cara correctamente, sino de escuchar sus problemas y hacer que sus ideas y voces se sientan escuchadas. Tenemos que seguir trabajando juntos para derrotar a este virus. Muchas gracias para su apoyo. And with that, I will turn it on to Senator Pat McGuire.
Thank you, Dr. Zike. Good afternoon. Governor Pritzker, you spoke of inspiration, motivation. To date, over 1,000 American healthcare workers and first responders have died of COVID-19. Over 1,000. In fact, Illinois ranks 4th among all of our 50 states in the number of healthcare workers lost to COVID-19. We properly revere these men and women as heroes. May their memory be a blessing. We know the people that work these jobs. In our families, in our neighborhoods, in our circles of friends, we know people who work in hospitals. We know nurses. We know respiratory therapists. We know people who work for fire and police departments. We know people who work as EMTs. We know people who work in nursing homes. We must protect them. We can protect them by following the advice that Governor Pritzker and Dr. Zike have been giving us since March. To socially distance, to wear masks, to wash our hands frequently, and to cooperate with our state and local health departments. I have plenty of reasons why the damage done by COVID-19 to health and the economy should never be far from my mind. My wife's a nurse. My dad was a fireman. My grandfather owned a tavern. But I need to improve. It was only this morning that I realized I should keep a stash of fresh disposable masks in my car for those occasions when I left my cloth mask at home and I want to go through a drive-through to get some coffee. I need to have those fresh masks in the car to protect myself and my server. What we can do to help stem this pandemic and speed our economic recovery are all modest steps. Again, wear a mask, keep 6 feet apart, wash hands frequently, and listen to the guidance of our state and local health authorities. And the payoff for those modest acts is magnificent. They will save lives. We all need to cooperate on this. I believe that this is the way to protect the healthcare workers, the first responders, in our families, in our neighborhoods, in our communities, in our state. And it's also the finest way to ensure that the ultimate sacrifice made by those 1,000+ healthcare workers and first responders has not been in vain. Thank you. Governor Pritzker.
Thank you very much, Senator. Happy to take questions from any members of the media. Yes, sir.
I just want to take some more what were some of the differences between the restrictions put out for Region 4 versus for this region, specifically I think about the indoor service at bars and restaurants. Can you explain some of those differences?
Sure. Let me begin by saying that the mitigation measures are known to everyone. We put them online. They're fairly common. Region 4 was the first region that had hit any of those metrics that we set for stepping back and putting new resurgence mitigations on. When we talked to the health officials in Region 4, they pointed out to us that they believed that if we set a slightly different set of mitigations around bars and restaurants, that would be effective. And listening to them, we felt like because they had been in communication with folks in St. Louis and had seen some of the challenges of being right on the border, that maybe that was a good idea to listen to them and follow their suggestion. I have to say that has not worked. And so they will, they are on a trajectory, unfortunately, now as I mentioned, in a week, essentially, to be right where, Will and Kankakee are. And indeed, their restaurants and bars, unfortunately, will be closed to indoor service and have the same mitigations that this region has now.
Well, why are you waiting?
Only because we had said when we put the mitigations in place that they would have 2 weeks under those sets of mitigations, and so there's 1 week left. I think we've had many, many conversations. I know Dr. Ezike, even over the last 24 hours, with the local health officials about the fact that this isn't working. And we want to make sure that people understand that it does take a couple of days, and that we're making this announcement and actually made it yesterday because we wanted to give bars and restaurants enough time so that they'd be able to make the adjustments that are required under the mitigation measures that we put in place.
Governor, I'm Michelle Gallardo, I'm the full reporter for today, and just to follow up on that briefly, isn't it though a bit of a double standard to give them this extra week?
Unintended. I mean, let me just say it was a mistake, in my view, ultimately to make the adjustment that we made in Region 4. But we were trying to understand the concept of, the region that they live in is slightly different. It's next to another metro area that was, that had different measures. And we wanted to be responsive to the local communities' county health departments. And so we were listening to, there are a number of counties there. There are only 2 in this region, but there are, I think, 7, thank you, in that region. We wanted to listen to them and try to follow the suggestion that they had made. Again, it was for 2 weeks. I will readily admit that was not a good idea, and that it appears now that we want to put those mitigations exactly in place as we had originally intended.
Governor, interestingly enough, I was here last week while I was in East Joliet on a story, and what struck me was the disconnect that still very much exists between urban areas and suburban areas in terms of masks. The entire time we were out doing this story, and we were out there all day, there wasn't a single resident wearing a mask. At what point we went to a local speedway to get some snacks, not even the employees inside the business, let alone the customers, were wearing masks.
Yep.
Why do we have this continued disconnect where people in maybe less populated areas just still believe that it doesn't affect them?
It's a good question. I think we're now in the realm of human behavior. I'm not an expert necessarily, but I will say this, that there was a time, I think not that long ago, when Chicago and Cook County had an enormous spike in cases, and other areas, some suburban, some rural, didn't. And there were people who felt perhaps that the mitigations that were put in place for the entire state, well, that they didn't need to follow them because, gee whiz, the virus is really only in Cook County or only in the city of Chicago. And I think we're now seeing that that's not the case. And we've been seeing that for some time now. And I've been saying it from the very beginning, to be frank with you. This virus knows no boundaries. And it can be transmitted no matter where you live if you're not following the mitigations, the basic mitigations that individuals ought to follow for themselves. Forget what the state puts in place, but wear a mask. This is not that difficult a thing to do. It is for a period of time. It will end. There are vaccines and treatments that are in development. I think we all have some optimism that by next year we will have those available to us, and perhaps we can do away with masks altogether. But in the meantime, masks, social distance, wash your hands. These are just basic, easy things that everybody ought to be doing.
Governor, it's been a couple
There's a
of
question
weeks
over here.
since-
There are other reporters. There are questions.
Okay, yes, ma'am, yeah. I'm sorry, I just didn't see you, yeah.
We don't do pools anymore, so if there
Hi.
Can you talk about why you're seeing an increase here in rural and country counties, what's contributing to them?
Yeah, yeah. So there are a number of things, and where these mitigations are actually designed to address them. It is true that, let me just talk about bars for a moment, because I think this is an important thing for everybody to understand. Why does everybody always talk about bars as part of the mitigations that you would put in place? The challenge with bars is often they tend to be packed with people. It is sometimes the case that even though we put capacity limits in, that the owners either don't have the ability to count the people that are coming in or to prevent people from coming in the door. But just as often, people who come in the door aren't wearing masks because you're drinking. Remember how COVID-19 transmits. It is essentially your saliva becoming aerosolized when you're speaking. When you're speaking, when you're yelling, when you're singing, when you're, and the louder you are, likely the more aspiration is coming from your mouth.
How is the restaurant
And
masking working? How will it work?
I just want to make sure I finish this thought, which is just to make sure that you understand. So when we're concerned about these kinds of closures, it's really, we look at each of these mitigations and ask, is this a problem in that area? Do we see that there have been problems with it? And the answer here is yes, and it's also the case, really, that's everywhere, that this is a challenge. But it's also the case with large gatherings of any sort. So we want to limit gatherings. These are all the things. This is not a political choice on my part. I'm not sitting around coming up with, this number makes the most sense. This is truly a reliance upon the doctors and their view of the data that's coming out of each region. Yes, sir.
So how will the restaurant masking work? Are patrons expected to wear their masks at all times except when they're eating or drinking?
So the idea is we're trying to keep everybody safe. So the idea is to make sure that the masks are being worn when the servers are coming to your table, so you're not exposing them. Making sure that at all times other than when you're not eating, that you're wearing a mask. Trying to, again, keep the aerosolization and, very importantly, the viral load in a room down. Right, because this isn't just a one-time thing where there's some, something that comes out of your mouth and it lands on the ground. This stuff can linger in the air, and the more people you have in a room, and particularly if they're eating and drinking, where you're again adding to this amount of saliva that's in their mouth, you're adding to the viral load in an area. So that's why we're putting these other mitigations in place.
Governor, I would like to ask you a question from my colleague Jeremy Ross at CBS 2.
Sure.
It is regarding the unemployment benefits. The question is that Illinois is one of only 11 states that have not started the process to get the $300 extended federal unemployment benefits authorized by the president earlier this month, with hundreds of thousands in Illinois still facing a jobs crisis caused by COVID-19. The question is, what is taking so long?
That's not accurate. It's just not an accurate question. We have begun that process. Indeed, it takes a lot of setup on an internal basis for us to move forward with that, and so that's what we've been doing.
All right, that's everyone.
Thank you.